Maybe Josh, maybe you could make the case. Why should healthcare be a core issue? Why should Canadians care about healthcare this election?
Yeah, for me, actually, the economy and health are so deeply interlinked that I think it makes a ton of sense that we're focusing on the economy in the federal election. We've never seen tariffs like this. This is a complete shift to our relationship and our trading mechanisms. And so, at the CMA, we're not separate from that. We see the impacts, we're worried about the impacts, but we also know how deeply linked income and health are. So when we see these threats to our economy and we know that income is the number one determinant of health, these threats also apply to our health. And we will see a worsening of the health of Canadians with our economy being attacked. And so we need a strong health system now more than ever to be able to help mitigate the impact that we're seeing on the economy. And on top of that, we get enough anxiety just looking at the economy. The last thing Canadians need is to add on anxiety about access to healthcare on top of that. So we want this to be a part of the conversation because it already is a part of the reality.
Terrific. Yeah. Yeah, no, I think I wanted to pull a thread on that because I think, the background in primary care, I think is really important here because I imagine that with income issues, primary care is where the need to access is the most acute already before income issues come into play. Can you speak a little bit about where we are today in terms of primary care access in Canada and whether or not we're making headway? Because I think it's on top of mind for everyone.
Yeah, and to be honest, I would say that that's where we see the most struggle for Canadians. We hear regularly about people who don't have access to care. I was going to a meeting with a politician to talk about healthcare access, and the driver of my Uber was like, "Oh, I don't have a family doctor." Like, this is very real. We all have either ourselves or have a loved one who's experienced problems with accessing the healthcare system. And even Health Canada, they came out with a study this year that said we are 23,000 family physicians short in this country. Like, that's a pretty jaw-dropping number that we're not going to be able to solve with one solution alone. And that, fits with the previous studies we'd seen where there's 6.5 million Canadians who don't have access to a family doctor. And when you're looking at, prevention, when you're looking at people who already have conditions, but we're trying to prevent them from getting worse. I mean, this is where that core part of healthcare happens and keeps people out of the hospital, out of the emergency room.
Mm-hmm.
So it's a big problem and a costly problem when people can't get the care they need and they end up either trying to get their primary care needs met in an emergency room or not at all, or those primary care needs go unmet for so long that they become acute. And now they do need that higher level of hospital care to meet those needs. So this is something that is very real to all of us. We all ourselves or loved ones experience this. It's causing harm to Canadians and it's costly. It's when we pay at the hospital level, it's far more expensive than investing in the community.